There are many medications available to help prevent cardiovascular disease. Gemfibrozil, also called lipid, is an important cholesterol-lowering medication which has been used effectively for 3 decades to help prevent heart attacks. Gemfibrozil is very effective at lowering triglyceride levels, and it helps increase HDL cholesterols to a moderate degree. There is, however, not a great impact on lowering LDL cholesterol. Since Gemfibrozil improves HDL, which is your body's natural cholesterol removal system, it's shown to be particularly effective in patients who have high triglycerides and low HDL levels. There are certain advantages to Gemfibrozil. The first is that it's relatively inexpensive compared to other cholesterol-lowering medications. The second advantage is that it produces very few side effects. A third advantage is that it can be used to produce beneficial effects in all lipid fractions when used with other cholesterol-lowering medications such as niacin or the bile acid binders. Although the Food and Drug Administration has not approved it, Gemfibrozil can even be used with the HMG coenzyme A reductase inhibitors such as Zocor and Mevacor. The fourth advantage to Gemfibrozil is that it has been proven effective in a major scientific research effort called the Helsinki Heart Study. In this study, 4,000 men with high cholesterol levels were split into 2 groups. Half received 600 milligrams of Gemfibrozil twice daily, while the other 2,000 men received a placebo. After 1 year of therapy, the Gemfibrozil group reduced their total cholesterol only 20 points, from 270 to 250. However, their triglycerides dropped from 175 down to 115, and their HDL increased 4 points. This is significant. There was no difference in the cholesterol levels for the group treated with placebo. After 5 years of therapy, there were 84 fatal and non-fatal heart attacks in patients who received placebo, compared to only 56 in the group taking Gemfibrozil. Perhaps the most striking feature of the study is the relationship between the length of the study and the decrease in the risk of heart attack. Here you see the number of heart attacks in the group receiving placebo increased gradually from the 1st year to the 5th year of the study. You can also see that in the Gemfibrozil group, over a period of time, the number of heart attacks decreased steadily. It's the dramatic separation with increasing time between these 2 groups that proves Gemfibrozil prevented blockages from forming during the study period. Gemfibrozil, however, did not appear to have any benefit in patients who had high HDL levels of 55 or more. However, one of the most important aspects from this study was Gemfibrozil's effectiveness in patients who had low HDL cholesterol and high triglycerides. These figures have led many physicians to find Gemfibrozil as the medication of choice for certain patients. In patients with triglycerides over 200 and ratios of LDL to HDL cholesterol of more than 5, Gemfibrozil produced a 3-fold reduction in the risk of having a heart attack. Another major advantage of this medication is that it does not have the adverse side effects that niacin has in many patients. That is, Gemfibrozil can be used safely in patients with diabetes, it can be used safely in patients with a history of ulcers, and it can be used safely in patients with gout. Gemfibrozil, like most of the other cholesterol-lowering medications, can increase normal wear and tear on the liver. We monitor this wear and tear with a simple blood test called ALT. Every day, a certain number of liver cells die and are replaced with healthy cells. This is a normal process. When these cells die, they release a protein called ALT into the blood. The blood test will assess the number of liver cells that died in the previous day. For an average person, the normal ALT level is between 40 and 70 units daily. Small increases in this level are of no concern because the liver can easily regenerate cells. But if the ALT level becomes 2 or 3 times higher than normal, we'll stop the medication, after which ALT levels will quickly return to normal with no permanent damage incurred. Generally, the need to stop Gemfibrozil will occur in only 1 out of 500 patients. Still, because of possible risk, patients on Gemfibrozil should have periodic ALT blood tests performed 6 to 8 weeks after starting this medication and every 6 months thereafter. A rarely seen side effect of Gemfibrozil may occur in patients with kidney disease, especially if they're taking one of the other cholesterol-lowering medications such as lovastatin or Mevacor. This unusual side effect is an increase in the wear and tear on the muscles, so it's important for patients to pay close attention and seek medical care if the development of diffuse and severe muscle pain accompanied by weakness occurs when taking this or both medications. The final question about cholesterol medications is how long should you take them, or do you really need to take these medications all your life? Gemfibrozil will not permanently change your basic metabolism. If you take this medication properly, under proper supervision, you will see an improvement in your cholesterol numbers, a reduction in your risk of having a heart attack, and in all likelihood, an increase in your lifespan. Once medications are stopped, however, cholesterol levels will return to their previous numbers and the benefits will be lost. In fact, all clinical studies showing an improvement with cholesterol-lowering medications were conducted in large groups of patients who took these medications 2 to 9 years. So, to answer the question, do you need to take these medications all your life? The answer is very simple. You only need to take them until you are 95 years old or until you no longer want to prevent a heart attack.